As stated before, mealtime is a time of social enjoyment. This is a time when people socialize and eat food. Communication with the residents during meals is critical. This may be the only time of day they get to interact with others. Make it worth it. Many residents look forward to mealtimes for this reason. Communication during mealtimes is shown to increase food and fluid intake in the elderly. So, this means you should talk to your resident during mealtimes. Starting a conversation can sometimes be hard to do when you do not know the resident very well. Can you think of any good conversation starters that you could use to begin your conversation with the residents? Some ideas to starting a conversation could be: ask how the resident is doing. Ask what they did that day or what their plans are for the rest of the day. If you do know the resident a little bit better and you are sure they watch a certain TV show that was recently on, ask them about it. Or tell them they look nice or you like a piece of clothing that they are wearing. It's always nice to compliment someone. Talk about other subjects that the resident can relate to or topics that you know may appeal to them, such as activities that are going on at the facility, weather, what they like to do in their spare time, about the meal that is in front of them or their food preferences, or even some verbal cues and encouragement can be appealing to some due to the motivation. When conversing with a resident, remember to always stay positive. A bad attitude is contagious, so even if you are having a bad day, remember to stay positive and smile when speaking with a resident. Communication can sometimes be difficult due to impairments or losses residents may suffer from. Communicating with residents that have hearing loss can be very difficult. Make sure you speak at a low-pitched voice that is at a slightly increased volume than normal. Never yell. This can actually make it harder for the resident to understand you. Face the resident you are speaking to so they know and can watch your lips. Speak slowly and distinctly. Some residents also have cognitive impairment. This can make communication very difficult due to their decreased understanding. With these residents, keep it simple. Use simple sentences and make sure words are pronounced clearly and slowly. Try to stick with single topics because switching topics can be very confusing for them. It may also take those who have impairment longer to process what you are saying. Be sure to wait patiently while they are thinking and wait for a response. You may also use gestures to help enhance verbal messages, such as stretching your arms out when talking about something that is very large. Elderly can occasionally display behaviors that are socially unacceptable. These behaviors are sometimes unavoidable due to mental conditions or medical diagnoses. Residents who act out during meals may actually act out using behaviors such as refusal to open their mouth or eat, biting down on utensils, holding food in their mouth or pocketing it in the cheeks, wandering away from the table, playing with their food, eating another resident's food, spitting food items out, wanting food items that are not allowed, or yelling and throwing food. Dealing with these behaviors can sometimes be hard when the resident does not fully understand what is going on. The main things to remember are to listen to the residents and try to see why they may be acting out. If they need something or want to do something, try to comply with their requests if possible. Be patient and understanding. Do not yell back. Appropriately cope with your negative feelings. Talk about what is going on or seek help or advice from the charge nurse. Some facilities actually have an action plan for certain residents who tend to act out. Ask the charge nurse about this. And most of all, be respectful. Do not laugh at the patient or coax them on. This is disrespectful. Studies have shown that many long-term care feeding assistants do not spend enough time feeding and assisting residents during mealtimes. This actually decreases their food and fluid intake and the enjoyment of the meal. This is mainly said to happen due to inadequate staffing. It has also been shown that increased amounts of time spent caring for the resident can decrease weight loss. If there is inadequate staffing at your facility and you are feeling rushed, Let the charge nurse know. She is in charge of the nursing staff and can possibly call in more staff or find others who are qualified to help. You must allot adequate time for feeding and assisting all residents you are taking care of. Make sure you take your time when feeding residents. If you are in a hurry, it can be very discouraging for a resident who has difficulty eating and can increase mistakes. So remember, take your time. As mealtime begins to come to a close, try to let the resident tell you when they are finished eating. Asking them may discourage them from finishing their meal. If they have not eaten much food, use verbal cues to encourage them to keep eating. Ask if the food tastes good or offer some other alternatives. If other residents are beginning to leave and mealtime is ending, encourage your resident to take their time to ensure they eat until they are satisfied. When they finally say that they are done, ask them if they are satisfied. If they are still hungry or not satisfied, again, offer alternatives or ask what they would like. If it is feasible, get this for them. And most importantly, never clear the resident's plate before they are finished eating. This is very disrespectful and against their rights of getting adequate food and fluids to consume. Now that we have discussed what to do before and during the meal, we will now discuss a few things to do after the meal is complete. After the meal is finished, clean the resident up. Make sure to clean their face, remove their clothing protector, and clean their hands. Record the amount of food they consumed, or tell whoever is in charge of recording it. If there were any problems during the meal or changes in the resident's behavior, tell the resident's nurse. They may need to be evaluated. See if they need to use the restroom again. If they do, take them or find someone else who can. If they are mobile and can travel alone, tell them something positive before they leave the dining area, like, "Have a wonderful evening," or "I had a wonderful time talking to you today." If the resident needs help moving, make sure to take them back to their room or wherever they would like to go after the meal is finished. Do not leave them in the dining area. Be sure to always remember a few things. No matter what, always treat residents with dignity and respect. Treat them how you would want to be treated if you were in their situation. They have the right to quality care and adequate food and fluids, even if they cannot feed themselves. Make sure you are taking proper care of all residents you are in charge of. In summary, mealtime is a pleasurable time for most, but can be somewhat frustrating for those who have difficulty self-feeding. To make mealtimes go smoothly, before meal preparations, such as getting all of the residents' necessary equipment, taking them to the bathroom, and making sure they are comfortable, are essential to prevent mealtime interruptions. When the meal arrives, it is essential to make sure the residents' food and fluid follow their ordered therapeutic and texture-modified diets. It is important to know what kind of feeding assistance the resident you are assisting needs during the meal. Make sure you take your time and communicate with the residents. After the meal is finished, make sure the resident is satisfied and take them where they want to go. Remember, all residents have the right to respect, dignity, and quality care at all times. You have now finished Module 3. Please move on to Module 4.